Good morning, good afternoon, good evening, whichever place you are, and welcome to this session. My name is Vincent Obita, and today I want to cover a very short topic that usually disturb a number of candidates in OSCE and has been requested by one of you. That's the aspect of monitoring frequency and also structuring of the monitoring portion of the care plan. This one cuts across different forms of patient cases, be it post-operative care plan, be it news patient, be it a PHQ-9 patient, be it a neuro patient, be it a MAST or a malnutrition patient. There are things you need to consider, and there are words that have to appear in that care plan for you to earn your full marks. So take note of those points. And this is something which is very easy. For example, when we talk of monitoring a post-operative patient, so under the care provided by nurses, under monitoring, you will talk of monitor and record vital signs every 15 minutes for 1 hour, then every 30 minutes for the next 1 hour, and every 1 hour for the next 4 hours as per the post-operative observation policy. That statement have to be there for both care plans and for both care problems while taking care plan for post-operative patient. For the news patients, which is a little bit easier, that one will depend on the news score that you have, but the general structure that will feature in your care plan would be monitor and record vital signs every 4 hours as per news policy and escalate to the nurse in charge. That would be for the news patient. For the PHQ-9 patient, you will have two statements. So the first statement will read and will revolve around monitoring and recording vital signs every 4 hourly and escalate accordingly to the nurse in charge. That is for the observation part. Then there is the part of the PHQ-9. So assess the patient's name, assess psychological status every week using the PHQ-9 or when advised by the mental health team. So you will split those two statements, but both of them fall under monitoring. Then it's after those two statements that you will have your 3 specific points for the PHQ-9 patient. When you go to the neuro patient, in this case, you will talk of monitoring and recording vital signs, including neurological assessment, every 30 minutes until the GCS is 15/15 or reviewed by the medical team, and escalate to the nurse in charge if necessary. Remember, for the neuro patient, the GCS is usually lower than 15 because either they are confused or they have issues impairing their perception and their neurological status. So you will monitor until that GCS is 15/15. Kindly follow that statement. For patients at risk of malnutrition, that's the most patient, the monitoring bit of your care plan will read monitor and record vital signs and malnutrition screening tool score or MAST score, depending on whether you had written it in full under the care problem. So monitor and record vital signs and malnutrition screening tool score every week and escalate to the general practitioner if required. You are escalating to the GP because this patient is at home or maybe in a nursing home, and again you are doing it weekly just to give a period for other assessments, okay? And also usually it's done by the community health nurse and they do such visits on a weekly basis. So with that one, you have the picture on the intervals of intervals of monitoring your patient, and also I've just given you a format on how your monitoring statements should look like, and with that one you will smash your OSCE. Thank you very much and have a lovely time. Meet you next time. See you then. Bye, and remember to subscribe to my channel for new content all the time. I wish you all the best in your OSCE, and kindly go and pass it. Thank you. See you then.